Hello, everyone, and welcome to this special Gemba 360 legal compliance webinar on the COVID Safe Plan and also the update on the Victorian state lockdown. My name is Nihal Semra. I'm the General Counsel and Legal Director of the law firm Kaizen Synergy. I'd like to welcome you all to today's session. Today, we're going to look at the specific restrictions that are being imposed and equally look at the updates for the COVID safe plan and what that in fact involves for agencies. While the lockdown is being imposed in Victoria, it has much broader ramifications. We're already seeing that there are specific permit requirements now being imposed and travel restrictions being imposed on the borders of Victoria and New South Wales, particularly on the Albury-Wodonga borders, and the requirements for permits to be issued and received for travel. That said, we're also seeing that there are some spot fires, as the Chief Medical Officer in Victoria has referred to them as, appearing in those particular areas as well too. As part of this, though, while we are going to look and see what restrictions, what it means, what are the four reasons and the likes, there is also that impact that it does have on that the COVID-19 situation is not over yet and far from it, and it can still be felt right across the country. So while other states may be rolling back restrictions and Victoria at this moment moving in the opposite direction, there is the need to actually look at, well, what are the restrictions in place, how and what impact does it have, but also then look at the COVID safe plan and what that involves and what your agency should look at as well too for its staff. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar, we do pay our respects to the traditional owners accordingly. This webinar is also being recorded and is being made available on our YouTube channel because it is a public resource that is being utilized by a number of agencies around the country as well. We will record this webinar all the way up to the question and answer part of the session where we do stop it and then open up the phone lines to take any questions that people might have as well. The Gemba 360 pandemic system is currently being used by agencies around the country, specifically around their COVID safe plan. Any of the materials that I am talking about today is made available also for yourselves to access. One of these parts that I'll mention is just around the pandemic module as well too. And effectively what this brings together, and I'll just jump into it here. Many of you have seen this already, which is the demo site that we utilize around this, and you can get all of these resources accessing it through the COVID Safe Plan dashboard that we have on here. And once you go in there, you can then access the individual, and you can see here that I've got my COVID safe plans, and all of the items I'm going to talk today is actually located on here as well. Each one of these is available for each individual agency, and as you can go in, you can effectively open these up and then action each of the items that I'm talking about today as well too. And this allows you to track specific items. While Victoria is going into lockdown, if there are specific items that your agency is based in Victoria, then you can actually follow these through and have these action. But this effectively means that you then can update your COVID safe plan directly on this dashboard directly through the Gemba 360 platform. That said, as we move back to the restrictions, some of the take-home message that I'll be referring to is to look at for those agencies that are heading towards the hotspot lockdowns and metropolitan and Mitchell Shire lockdowns as well too, is that you need to start to have a look at some of the operational documents and switch those back on again as well. Some of those will include the daily assessment forms, the working from home approvals form, workstation register, cleaning registers, service actions, and quality and compliance forms as well too. These are linked to your Safe Work Australia requirements, and obviously, as I've mentioned in the past, these can feed into your COVID Safe plan. Having these obviously available to your staff will make it easier to not only manage your COVID Safe plan, but also meet specific requirements and obligations that I will cover off today. So these are certainly the templates that are being made available for people to utilize, and you can actually access these even on your Gemba dashboard as well too. So let's have a look at the key areas around this. This is around the Victoria lockdown and also the COVID Safe Plan structures that you should already be having in place. For agencies that sit not only in Victoria but also across many states as well too, or located in New South Wales or Queensland, for example, then really the COVID Safe Plan should allow the flexibility to re-ramp up restrictions if required. And so what we're seeing in Victoria is actually very, very relevant across the country as well. So with the message from the Premier in Victoria at the moment is to effectively stay home, and we are going back into the 4 reasons to leave home, and that is to get medical care, to work or study if you can't work or learn remotely, for your daily exercise, and to buy the things that you need. And these are really for essential items only. There will be obviously and continue to be variations between state and territories due to the public response and prevalence of COVID-19, as we are seeing as of today as well too, and variations especially between WA, Queensland and Victoria as examples of that. So what are some of the rules? Well, effectively, when we're looking at this, the national cabinets and a lot of this information, I'm going to say it's like Groundhog Day. We've been here before with it. We've seen this back on the 30th of March, and a lot of the slides that I'm going to utilize is in fact going to revisit some of these as well too. So effectively, under stage restrictions, there are new directions which will mean that what was previously advice about staying at home will now become enforceable, and that will effectively start from midnight. And it's similar to what we've seen on the 30th of March. Now, what we effectively have now in place is a 6-week period, and this will be reviewed as required. Effectively, it will go back to on-the-spot fines of $1,652 for individuals, and also $9,913 for businesses, and larger fines can also be issued through the courts as well. Now, in saying that, one of the areas that we've also got to look at is the other consistent rules that have also come up. There are rules for tenancies that continue to operate, and this is also across Australia. So a number of months ago, there was, with this health crisis, at the time there was in Victoria, it was noted that there was going to be an economic crisis as well too. And effectively they put on a moratorium on evictions that were to be introduced for a period of 6 months. This, they then developed up a code of conduct around it as well too. And what we're seeing is that these are in fact continuing. Equally, the fines that we've seen before, and I mentioned these just previously, is that the Victoria Police can issue fines of on the spot of up to $652, and also $9,913 for businesses as well too. There are also new fines being imposed on the New South Wales border as well too, if you don't have a valid permit, and also people who fail to do that can also get fines of up to $11,000 is what they're reporting at the moment as well. So effectively, these directions have been issued under Section 203 of the Public Health and Wellbeing Act, and a lot of these requirements and directions effectively need to be followed. The other part that has also come up for schools, for community services, is this area of mandatory vaccinations. And effectively, back in February, there was a vaccinations bill that was passed. And this covered for all healthcare workers in the public and private hospitals and ambulance services with direct patient contact. And they were required to be vaccinated, including doctors, nurses, paramedics, dentists, orderlies, and cleaners, and staff working also in public sector and residential aged care services. So workers who refuse to be vaccinated may have first faced work restrictions or redeployed to other parts of the health service. So as we're going effectively into lockdown and we're seeing the prevalence of COVID-19 spread, it is something that your agency should also carefully consider again too, in terms of rostering staff and your compliance obligations to the mandatory vaccinations bill as well. And this was repeated on a number of previous media occasions by the Chief Medical Officer around ensuring that people have the appropriate vaccinations in place. So effectively, what we're seeing from the lockdown is that we're repeating back to the 4 reasons to leave home, to get medical care, to go to work or study, for daily exercise, and to buy essential things as well. On that, what I will suggest is that your agencies look at, as part of its own COVID plan, effectively what So effectively what we are seeing is these 4 requirements that your agency must actually look at. And as part of its COVID safe plan, what you should be effectively looking at is this specific requirements to incorporate within your COVID safe plan in the event that your agency actually needs to reimpose its own specific restrictions again. And it is something that a lot of agencies we've spoken with and helped them with their COVID safe plans have actually missed. The COVID-19 public issue is not going to go away quickly. Yes, it's being focused on Victoria at the moment, but this could very, very rapidly not only spread across to other states and territories like we've already seen it start to do, but effectively spot fires can re-emerge as well. So your COVID safe plan needs to have the flexibility to ramp things back up again. Now, that said, as part of this, when we look at the COVID safe plan, the Prime Minister has used this framework for what is actually required here. And with it, there are a number of different state examples. This is the one from South Australia in terms, and we will be circulating this material around. There is also others from Queensland in terms of what the COVID safe plan should actually look like. And Victoria has come up equally with its own COVID safe plan back on the 30th of April. Now, that said, when each of these go through, and I will just take you back to this dashboard, what each of these have is effectively the same things around step 1, step 2, and step 3. And there are core areas that you should be looking at around providing a safe work environment for staff, how you're continuing to deliver safe services to your clients, and also looking at internal monitorings for your own services as well too. One of the other things that we have also covered off is individual standards. And again, so if you're a school, for example, you'll have specific standards that you need to meet. We've actually started to include these in the COVID safe plans. And I will say that in reviewing a lot of the current state plans that we have seen, just going back to these 3, what we haven't actually seen is some of the more basic information around some of the quality standards that agencies need to be covered as part of their normal service operations. So within it, what we have seen is, yes, there's an overlap around some of the legal compliance areas. What is missed is around some of your quality standards areas. Now, as I've mentioned around this, effectively what you should be looking at is the checklist, which I've mentioned right at the start of this session, is around the requirements for keeping workers safe, requirements for social distancing, requirements for keeping your workplace clean to stop the spread of COVID-19, and requirements for workers and customers' health and hygiene. So those are effectively the main checklists that you should be looking at as you move through this. The best practice guidelines, there are states and territories that have issued and industries that have now issued their COVID safe plans. But effectively, what they have missed is around that quality safeguards areas. And that's important, especially for your own accreditation space. With this, again, whether you're moving or restricting, whether you're moving into lockdown or starting to restrict, go back into restrictions, going through this process of looking at the conditions for entry. There are some agencies like aged care and residential services that have simply closed entry off to all visitors at this stage, where they are in hotspot areas or they are providing services to vulnerable people. There are some agencies that have also looked at the flow of clients in and out of their buildings. And again, this is what your COVID safe plans should be looking at. There are also the customer interactions as well too, completing services and payments, how the transactions occur. Importantly, looking at communal facilities as well, and what is the shared areas that need to be hygiened, cleaned, what's the rosters for those, and also looking at managing egress and emergency evacuation as well too during this time. So with it, as we go through and look at staff practices in terms of not only how you can keep your staff safe by limiting physical interaction between workers and clients and other workers and other persons, the other part that you should be considering is what is the training that you need to inform your staff on. And with it, what we have seen is agencies being able to add in things like their online training and their own training that you have. All of these webinars that we run is also located in your Gemba 360 College dashboard, and you can access that to effectively meet your training requirements as well too. So with it, the other parts that we suggest that agencies look at is, again, the public health directions from your respective chief medical officers, whether that be, in this example, Queensland or New South Wales, but more importantly, Victoria. As Victoria's lockdown continues over the next 6 weeks, what direction the chief medical officer will say, not only about prevalence, but also transition of the disease across different state borders will obviously need to be managed and reviewed regularly by your agency. The other part that is also needing to be looked at is around reviewing your risk management requirements as well too. Staff need a place to effectively register incidents, hazards, and near misses that they may already have, as well as making sure that you regularly audit your checklists as well. Many agencies we've found will have checklists that staff complete or will have checklists that cleaners complete, but no one's going and taking the time to actually undertake the audits and say, well, if they have answered that there has been an issue with one of the sites or some non-compliance has come up, how are we actually addressing these particular issues? Equally, what a lot of businesses have started to do and states and territories have started to request businesses do is to have a statement of compliance that you print out, sign and date and display on your premises. And the purpose of this statement is to show and to demonstrate to the community and the relevant government authorities that you are following the COVID safe plan as well too. And equally have a space for other information, for people to ask questions around how you are in fact managing things as well. As I've mentioned, all of these are actually on your Gemba dashboard, and you can access the templates and these materials around these as well. As the various Commonwealth guidelines change, these are then adjusted for you to, in fact, utilize as well. So within it, these are parts of the areas that I did want to mention around the COVID Safe Plan in terms of its structure. Now, part of the areas that agencies have asked us about is what is the framework and how should we actually structure when we're looking at each of these areas. And effectively what we've suggested them to do, and I'll just go back one slide, is to look at the legal compliance framework, look at the policies for your agency. A COVID Safe Plan should not just be the plan itself. It should also include supporting policies for staff to be able to follow, and also pandemic forms for them to complete in order to get you the information you need and to support them as well. So when we've looked at some of the industry plans, or we've looked at some of the state or territory reference documents, they talk about the plan itself, but what's in fact sometimes missing is around that quality side, which takes into account the policy or the forms that you need in order to support that. So as part of this, it is important to be aware to get your plans up, because it is, I'm going to say, covered by the duties of directors and officers. We've had situations even in this past week where agencies have contacted me and asked me around what's my legal obligation around this, and CEOs have called. And let's be quite clear, there is a duties as directors and officers, and part of that is to, outside the COVID public health challenge, there are duties as directors and officers of companies, and that is to ensure that your companies and businesses have appropriate policies and procedures. And that is no different even during this crisis. In fact, it's probably more important to have these requirements and information in place to so clearly support workers and also services you provide to your clients as well too. But again, some of these very clear principles that are sitting here is around bringing it back to maintaining social distancing and good hygiene, staying home if unwell, and ensuring you frequently clean and disinfect communal areas. And also the COVID Safe Plan is available for workplaces and other premises that staff visit and use too. So one of the things that we do mention is the importance of the COVID Safe Plan is that COVID-19 will be with us for some time. So it's important that your business has a plan and continues to plan to keep your workplace healthy, safe, and virus-free. And that may well be for some agencies looking at what's happening in Victoria, and also for Victorian agencies to put in these restrictive measures to be able to ramp up and ramp down as the prevalence of COVID-19 affects your agency. So what is this COVID Safe Plan going to do? Well, really what it's targeting to do for yourselves is to do four things, and that is to ensure staff are kept safe, ensure community and services are supported and delivered, and if you need to change your business service, then it supports you to do that, and accesses support to continue to deliver services. And as we continue to move across step 1, step 2, and step 3, it is something that your agency should have a plan to move as well. Equally, as I've mentioned, as we've seen in Victoria at the moment, you may need to ramp back up. So if you are sitting on step 2 at the moment, you may need to have the plan to actually ramp back up to step 1 if required, or even past step 1 if outbreaks continue as they are. So effectively, I'm not going to go through each of these. These slides will be made available to you as well too, of what step 1 covers and step 2 covers as well too. It is taken directly from the session itself. What we have tried to mix out here and avoid is the myriad of legal compliance obligations. And this is just some of the material that's already out there. In doing this, and we've covered this off before, in having your COVID Safe Plan in place, we have taken a quality standards approach, and we've used the QIP model here, where we look at compliance, self-assessment, and then identify areas for improvement. And it's bringing it back to that plan, do, check, act process. And the same thing happens whereas we are going through further lockdowns at the moment in Victoria. You should be able to ramp up services. So effectively, the quality cycle is effectively being used and identifying areas of what you are missing at this point in time. So the structure around this and even these materials are based on legislation that we're seeing from things like the Biosecurity Act and also the health and well-being legislation, which we've brought in. We've looked at the checklist from Safe Work, as well as the AHPPC, which is the committee that informs the health department on, the Commonwealth Health Department on, as well as individual health sector pandemic plans as well. What effectively comes out of that is your self-assessment checklist that I've shown you, and that gives you the ability to identify gaps that you may have. Those gaps can then be matched into your COVID safe plan directly. So effectively, what your dashboard allows you to do is look at your safe plans that you have. You've got your compliance ticked off. You can undertake the self-assessment, which we'll send across to attendees, and also then use this to identify areas for improvement, and that will drive your COVID safe plan. Now, as part of this, there are a number of obligations that all employers should do as you're moving through these lockdown, as you're moving through initial lockdowns for yourselves in Victoria. And then even as we then move past the 6-week plan, so 6-week process into stage 1 and then look at stage 2, or if you're based in other hotspot areas, Albury and the likes, where there is talk of prevalence of COVID-19, then effectively it's following these same points is what all employers should do. And that is things like having policies and procedures and technology to support employees working from home, looking at social distancing, trying to ensure 4 square meters per person, discouraging carpooling, promoting good hygiene, and effectively looking at frequently cleaning, modifying rosters. So each of these 14 items is things taken directly from the Commonwealth Health Department guidelines. It was something that was taken back a number of months ago, and we're still using them and making reference to them today. So with it, each of these 14 items should actually be included as part of your individual's 3-stage step, and it's something that we've actually looked at doing. Now, there are obligations for employees, and effectively what this means is that it's not all sitting on employers to do. So with it, even Safe Work guidelines, and again, we'll circulate these materials, talks about all these different items that effectively employees should be doing. And that is, if you're concerned about that it's at the workplace, you need to isolate, you need to assist in cleaning or seek advice, ensure that if you are being transported from or to the workplace or the likes, or traveling, then again, there are a whole lot of obligations that people should be following. With it, as I mentioned at the start of this presentation, it's important to look at work health and safety is a responsibility for all staff and for ensuring a safe work environment and not to put the community at risk. So when looking at the Safe Work guidelines and your COVID safe plan, especially in lockdown at the moment, then where people should be focusing is on looking at daily assessments to look at prevalence of COVID-19 within their agency or services that may be affected, looking at working from home approval forms, workstation registers, cleaning registers for your different site, as well as service action plans as well too. What this will give you is the information to then effectively resource certain areas within your specific business area. Whether you're a school, whether you're a community health service, whether you're a not-for-profit service company, for example, selling goods at like a thrift store and the likes, and a clothing store, then again, following these simple checklists will give you that information that you have. It doesn't matter whether you're a small agency or a very large one. Effectively, we've seen it already now with a number of agencies following these particular checklists and tools. It gives them the information they need to ensure that they're delivering safe services to the community, and also that their staff are kept safe as well too. You'll find these checklists and information also on your dashboard, but we'll circulate these out to you today as well. Now, On this, the other parts that I've mentioned, I've taken you through the different dashboards before. I will just finish off by saying, let's look at the specific recommendations around your plan. So effectively, your COVID safe plan obviously includes the plan itself. But what is required is around some policy documents that describe each of the steps and support staff to execute your plan and follow it through, plus also the pandemic forms that I've spoken about today. Aligning your policies with your COVID-19 disaster management directions will ensure safe community services. It'll make sure that you're in compliance with your WorkSafe obligations, as well as Fair Work guidelines as well too, and also ensuring that you deliver safe services to the community. At this time, we will open up the phone lines and stay on the lines to answer any questions that people might have. At this point in time, we will stop the recording, but I will just say, if you do have any questions after today's sessions, please contact us on 1300 360 360 or email us at support@gemba360.com.